specific effects of certain types of exercise, how it's going to increase your growth hormone, and also how to lengthen the breakdown of something called a telomere, which are these little strands on the end pieces of your chromosomes, which is your blueprint for survival in life. You can manipulate both of these things. The implication of this is far-reaching, that you don't have to be at effect. Your body's made up of something in the neighborhood of more than 10 trillion cells. Not quite as much as our national debt is going to be, but pretty close. So you can put it in perspective there. 10 trillion cells. You can't even begin to figure out what that is, right? But you age only because the cells, the memory of the cells, begin to break down and your cells age. So if you can control your cells, you can control your aging process and how your body begins to react to all kinds of things. If we can, stop it, then we stop the shortening of something called these telomeres. Now, I don't want to get into it too deeply because then I'm going to lose you in the chemistry and the genetics of it, but nevertheless, visualize these little barrels, real short, and then on the end of it you got these strands, and these strands are doubled, and it's called the double helix, by the way, and that is your genetic code for your life. So we want to extend the length of the telomere. We want to stop it from breaking down too quickly, and what we're finding is that we can do this through exercise. There's a certain intrinsic rate of the shortening of these telomeres just to keep you around, to keep you on this planet. That's even why if you have a perfect diet and you have an exercise program, generally you're going to live about 120 to 130, 140 years if you do everything the right way. But how many of us make it in good health to that level? Well, we want to have good health, and we want to make sure that, we can do what we want to do. We have the strength and so forth, and we don't get there too often. We have exposures in our environment, insults and free radical destruction, trans fats. We have, people getting fat, obesity problems, and people smoke too much, and they drink too much alcohol, and all of these things contribute to the shortening of these telomeres. So you die of old age when you hit 70 to 80 years old. Not a good thing. You don't have to do that. There's so many patients that come into my office, and they're my heroes, and these people are like 90, 95 years old, and they're still going. They're playing tennis, they're working out, they're chasing the opposite sex still. Yeah, really. I'm not kidding you. I'm not making this up. And you look at them and say, how do you do that? One of my patients' mothers is 104 years old and still doing well. I want to do that. So I want to find out how to maximize my individual capacity. And my whole professional career, my whole professional life has been dedicated to finding those answers so I can give them to you as well. Well, there's a lot of really good news out there, and it starts with not only lifestyle, but exercise, and exercise is part of lifestyle. A lot of studies have been published recently, and there's a direct association between reduced telomere length, these strands we're talking about shortening, and the type of exercise that you do. And what we need to do is we need to talk about that so you can apply that. And that's what we're going to spend this program on. I'm going to give you the capacity, the ability to be able to turn your life around and increase your own growth hormone so you don't have to go buy growth hormone modulators and so forth. And there's some nutritional pieces, but that only helps it a little bit. That doesn't replace the exercise piece. And that's what you really need to know. You can't replace the exercise piece if you really want to turn this around. And how long does it take? It takes 20 minutes, about twice a week, maximally 3 times a week. And what the experts are finding, that if you do it more than that, you actually will go against what you're trying to get done. The other exciting benefit of this is your ability to naturally increase your growth hormone and reverse the aging process. I mean, this is huge. I mean, it's like amazing. I don't know about you, but 2011 for me, since I've learned this stuff, is going to be all about that. I'm going to start in the morning, and I'm going to start exercising, and I guess I already did because I cheated. I've already started to incorporate this. And it goes against what I have been doing the last few years, but it's exactly what I used to do when I was young, and the type of exercise that I did early on. You're listening to Dr. Tom Roselle Live. I am in studio. 888-630-9625. 888-630-WMAL. Looks like we've missed the snowstorm that's headed up the coast, and New York and Philadelphia and Boston are going to get buried, but not us. Thank you very much. I appreciate that. A little snow is nice, but you know what? I came from snow country. I came from a place that 120 to 200 inches of snow a year was not unusual. It's called the western part of New York State. But they knew how to handle it there, and we went to school with a foot of snow. But here, not so much. So I'm glad that somebody else is getting it, and we are going to be just very fine. Thank you very much. 888-630-9625. Talking about how to increase your body's capacity to produce its own growth hormone at any stage. You know, if you really want to turn things around and you want to maximize how your body responds to its environment, you want to increase the length of time that you're going to be on this planet, but to live well, you want to get rid of some of that body fat and improve your muscle tone and make sure that you don't have, the wrinkles and the furrows and that sort of stuff. And also increase your sexual capacity, your energy, and your ability to have sexual performance. This is what we're talking about. This is what it's all about. Because when growth hormone goes down the tubes and it starts declining, by the way, after age 30, you go into age-related degeneration, you got to be able to stop it. Is there a way to stop it? Yes, there is. And it's out there, it's referenced, and it's not just my personal idea. But you know what? I like the idea. So we're going to talk about that, and I'm going to give you the exercise pathways, exactly what you need to do. Couple that with a decent diet, which you should be doing anyway, and getting the right amount of sleep, maximizing your vitamin D status. And there is a very specific nutritional product that if you put into the system along with this exercise routine, I think you're going to be very surprised what's going to happen. Meantime, let's go to the phones. Ruth, how can I help you? Thank you for calling.
I'd like to know what you recommend for muscular back pain. Do you recommend acupuncture?
Well, let's talk about it first. How long have you had the back pain?
I've had it for a couple of years.
Okay, probably it's not muscular. Muscular is usually from a sprain, strain type of thing that modifies itself one way or the other, will leave you some weakness. Is it localized? Is it just in one area of your back?
It's my lower back. I also have a deteriorated disc that has shown up on an MRI.
Okay, so that's what I'm alluding to. The fact is that it's probably more than muscle. You've got some degenerative changes there. If the vertebrae are out of position, then you're going to have nerve roots that are going to be irritated, they're going to be pinched, and you're going to have other areas of your body not working. Your legs are going to feel weak. You're not going to be able to, walk the way you want to. And sometimes, as you get moving around, it feels a little bit better. But if you do too much, then it begins to break down. So let me answer your question. There's two things that are the most effective for any kind of back problem that is not pathologically related, meaning tumor and cancers and so forth. One is acupuncture, and the other, in conjunction with it, and you have to decide based on examination which one is a priority, is manual therapy or manual manipulation.
Uh-huh.
And generally, a full examination will show you. We, in our practice, for example, we treat tremendous amount of structural problems, whether low back problems or neck and shoulders or arms, as well as the other autoimmune and functional conditions that we see. But the combination of both is extraordinarily effective. Then you couple that with exercise and some dietary modifications, and you can get a lot of resolution and strength and return of normal function. So your short answer is yes. Does acupuncture work? Absolutely. And does it work in conjunction with other things? Absolutely. And you have to decide based on somebody who knows their diagnostic capacities relative to this type of problem, which one or a combination of both is the best for you. But
by
well.
Manual manipulation, are you talking about chiropractic?
Chiropractic adjustments, osteopathic manipulation, things that are specific. And those really are the only two areas, are only two professions that really have a vested interest. Chiropractors first, osteopathy second, and that combined with acupuncture. In our practice, we have people who do traditional Chinese medicine. We have nutritionists, we have massage therapists, we have chiropractors, we have people who specialize in an area of manual modes called applied kinesiology. So you have to look at it from a multidimensional point of view, because there's really only three things that cause anything. There's either injury to the body, there's biochemical imbalance, things you eat you shouldn't, things you should that you need more of that you don't get into your system, the environmental pollutions that are around you, and the third is stress, or a combination of all of those things. So if we look at the system and ask the question, why is that? Why did it happen? Then it begins to give you the understanding of which systems are being affected and how they were affected and which therapy would be the most useful.
Wonderful. Your name has been recommended to me by, you may remember, Jag. He's a very, very nice Indian fellow.
Yes, absolutely.
And Jag lives here at Asbury Methodist Village, where I do, and he has recommended you highly. Unfortunately, we're going to be away until April, and I don't know what we're going to be traveling in Florida.
Well, good. At least you're going someplace warm. Where in Florida are you going to be?
We're going to be traveling all over.
Okay. Well,
and, do you know of anyone?
Yes. The short answer is yes. What I want you to do is write me at rosellecare.com and let me know generally the areas that you're going to be in.
Unfortunately, excuse me, doctor, we don't have a computer.
Okay, then do this. Call the office.
Yes.
And leave your name and phone number and reference that I talked to you on the radio. And I will call you back. And then I'll find out generally where you're traveling, and I will recommend some people that I would go to.
Very good. And your phone number?
703-698-7117.
7117. That's very helpful, and I thank you very much.
You're welcome, Ruth. Have a great day. Thank you for calling.
Thank you. Bye.
We're here at 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're talking about how to increase your growth hormone and get your life back, extend your life, and live well. And we're saying that it has to do with a certain type of exercise. I recently read an article by a physician who has a wellness website, and he had gone and listened to a guy by the name of Phil Campbell, who is a fitness expert, and he was talking about these exercises he was doing, and this guy's somewhat opportunistic, and he renamed what we're going to be talking about, and he calls it his Peak 8 style exercises. However, having said that, this stuff has been out now for a period of time, and a lot of people rewrap things. We know about them. We know how they're applied. But the truth of it is, it works, and it will take off body fat, particularly around your organ systems, and it will gain muscle mass no matter how old you are, and that's the key. You have to understand that this is not age-related. This is about all of us. So we want to trigger human growth hormone, and we want to increase our lifespans, but we want to increase it from a qualitative point of view. So what do we do? How do we turn this around? If you read some of the studies that are out there, and a particular one that was published in 2008, I happen to have the article in front of me, it talks about humans and other mammals particularly, that they go into a reduction of growth hormone, and it's correlated with increased percentage of body fat, but particularly inside, around the organ systems. And then we lose our muscle mass, and then we lose our ability to do things physically, and we drop our immune system, and our physiology declines, because then we begin to lose estrogens and testosterones and all the things that make us youthful. So we often say, well, what do we expect for our age? Well, I don't know about you, but I expect to live well and live long, so we need to make sure that we know how to maximize it. Well, these studies are showing, and there's many of them now, that if we can affect the body's ability to produce its own growth hormone and not destroy the body by other types of exercise, that we can get this stuff around. I'm going to show you how to do that in a second. We're going to go through step by step. So don't go away. I need to take a call. Gilda, how can I help you?
I hope so, sir. I'm 79 years old, and I have high blood pressure, which was always controlled with the Tenolol. As of, I would say, about a year, I can wake up at 3, 4, 5 o'clock in the morning, take my pressure, where it's the highest of the highest. It could be from 190 to 185 and so on.
What's the bottom part?
The bottom part is always good. It could be in the 50s, but sometimes I hit the low 40s.
Okay.
And I do have cardiovascular disorder as well.
Are you taking any kind of diuretic besides the atenolol?
No, sir. This is my problem. I cannot tolerate, and I found out why. I had a certain test that I asked my doctor to have me done, and it indicates that my body cannot metabolize cardiovascular disorder, cardiovascular RX.